Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
So a couple weeks ago, my dog Beau wasn't feeling good. I can always tell when he's not feeling good because he won't eat, and B, he goes right under our dining table and just puts his head down for whatever reason. Brandon was on the road at the time, so it's always more stressful when he's not there, and I had to make an informed decision, so I brought him in. I think he was really dehydrated too, so turns out he had a pancreatitis attack. He's had it before, one time before, so Dr. Marlowe was really great. They actually kept him here for 2 nights, 3 days. He was on IV and different types of medication to help calm his pancreas. It was kind of scary, like I had to come visit him and take him out for walks. I think he was kind of, it's scary being in the hospital for so many days, but they took good care of him, and turned out he was good to go after 3 days.
Pancreatitis is very common in dogs because you can imagine dogs will eat anything, and they'll get into fatty foods or anything outside, and it causes their pancreas to become inflamed. And then a lot of the dogs will show symptoms like Beau being lethargic, not wanting to move around as much. Some of them have vomiting episodes, but they're pretty painful. It's a very painful condition. People get it too, but in dogs, it can last a good time until they start showing clinical signs warranting the owners to come in and seek medical advice. So the treatment is just resting the pancreas, as Melissa had said, that we put him on IVs. Beau is on IV pain medication, a morphine-like drug to take away the pain, and then drugs to stop the vomiting and to stop the nausea. And they're here usually a good 2 to 3 days. Sometimes cases are even more severe and they're here longer, but he did really well. He's an excellent dog, and he is really good with his medical treatments, right, Beau?
Are going to be taking radiographs on a parakeet today that had lead poisoning, so we need to just recheck his x-rays today.
Birds generally tend to get a little stressed out when you do anything to them, especially if you have to handle them. So a lot of times if you can just put the bird here in the bowl over it, you can take a beautiful x-ray without having to actually restrain or stress out the bird.
And you can see the lead in the stomach. Birds have more than one stomach. This is the ventriculus, which is the last part of the stomach, and the lead pieces get stuck in there, and it causes them to be lame and not be able to use their legs, so his leg is all crooked like that. There's not a lot of alternatives because he's so small. In animals, or small animals, or in larger birds, we'd actually go in with a scope and try to get that lead particles out of there. But in such a small bird, we don't have a scope that is that small. I'm going to try for another month to get those lead particles out, and then we'll re-x-ray and see in a month if we're successful. If we are, then we're going to treat for lead poisoning again, and then hope for the best. This little baby came in and was seizuring when she came in, and the owners were unable to take care of her and take care of the medical costs. involved because we're not sure what's going on with her. If it's a liver shunt, that means blood shunted around the liver and not the blood supply not going through the liver, and detoxifying certain components of food. And so the toxins are kept in the bloodstream and it makes the dog seizures. So right now we have her on medications to combat that, those toxins that are in her system. So now she's doing really super well, but we're just not positive as of yet on if she's going to need surgery or not. So we're going to keep her here, try to find her a foster home for a while, run some more tests on her, and then eventually we'll look for a home for her.
Today's show is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, and Camp Bow Wow. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world on our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. HAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. HAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, personalized care for your precious pets.
Good afternoon, I'm Dr. Dale Cresson. I want to tell you a little bit about my specialty in animal dentistry and oral surgery. I've been serving the Milwaukee metro area for a little over 10 years, and I'm very proud to be part of the team of the Milwaukee Emergency Center for Animals. So today, I want to just take a moment to tell you about the #1 disease of all diseases that are diagnosed in your pets. That's right, the #1. And it's called periodontal disease. Periodontal disease is an infection that starts out with bacteria on the teeth and it gets to be an infection that spreads deeper and deeper and causes the loss of teeth, unless you start doing things to prevent that problem. So periodontal disease is this infection, and if you can brush their teeth every single day, it's going to help tremendously. And what we like to see is a nice pink-looking tongue like that. Looks like it's holding there.
So all of the endotracheal tubes have a cuff to be able to be inflated, which protects the airway from water or any debris during the dental procedure.
And we also have a lubrication on the cuff so it doesn't, trying to prevent it from irritating the throat when they're under anesthesia. So we try many, many steps to make it as comfortable and safe as possible.
So to attach the appropriate EKG leads, this monitors the electrical impulses of the heart. Around here we have a tiny little blood pressure cuff for a tiny little patient, and that gives us readings every 2 minutes, which her blood pressure is looking just perfect. So little dogs in particular get cold very fast. Has to do with the surface area to their body. If you think about like a large polar bear in the North Pole, they stay very warm, but a little chihuahua in Mexico gets cold very fast. Now when you're under anesthesia, you're unable to thermoregulate or shiver, and then also the gases that we use causes vasodilation. So hypothermia under anesthesia is very, very common, and warm air conductive warmers like this, similar to a bear hugger, do great wonders for keeping them warm. The other thing is when we're doing a lot of dental cleaning, they get wet, and that allows for the patients to get cold really fast. A lot of people have a fear of anesthesia for putting their pets under, and by doing a lot of these appropriate safe measures, we can keep anesthesia as safe as possible, and most importantly, in my opinion, keeping them warm is one of the safest things you can do for anesthesia. How long does it take for the patients to recover after anesthesia? And if we keep them warm and keep them on a nice plane of anesthesia, they're usually awake within about 10 to 15 minutes. They're still a little bit out of it, a little bit groggy, but most of our patients go home within about an hour and a half to 2 hours after waking up. Thank you.
I think the most difficult part is not per se the euthanasia, because sometimes that is humane and it is a wonderful part of our job, because we can let animals go and, you know, if they're suffering or in agony. But I think the most difficult part is to be able to, where human medicine doesn't have to deal with this, if the owner does not have money to take care of the animal, and it's something so fixable, and you know it, and you have to euthanize that animal and let them go, and whereas you know that if they just had the funds, they would be able to take care of the animal. And then I think the second most horrible part of our job is when we see the abuse part of the job too, like for example, Beatrice, you know, that's just one example, or the case that where the dog was thrown out of the car. You know, those types of things really drain on you, because you see, how could somebody do this, you know, to an animal? So
here is a mask as well. So our color is looking very, very good. Things are looking good as far as excellent breathing and excellent EKG. And what we do is we lightly clean and we want to get under the gum line, because the difference between cleaning without anesthesia and with anesthesia is significant. We need to be able to clean underneath the gum line, because the bacteria that causes periodontal disease is located deep under the gum line. And when a patient is awake, very, very difficult to clean safely under the gum line without hurting the gingiva. And the gingiva is this protective tissue that helps them keep their teeth in place and helps them be pain-free as well. So now x-rays are one step of diagnosis and periodontal probing is another, and that's just like the hygienist goes in our mouth and they take little measurements to determine whether the bone is normal or abnormal. Once again, without anesthesia, there's no way you can properly evaluate whether there's bony pockets. So anesthesia is a central part of diagnosis and treatment. So the veterinary dentist, our goal is to save teeth, not to remove them. And essentially this is what we're trying to do, is determine what stage of disease do we have and what strategies can we use to save them. And the number one strategy is the owner brushing these teeth. So very nice looking gums here, nice and pink, nice and healthy.
Here at Pet Supply Port in Saukville, Wisconsin, we recognize that pets are part of the family. That's why we strive to offer the best quality pet food and pet supplies at the most affordable prices. From frozen raw diet and wholesome products to educational seminars and pet total wellness, Pet Supply Port is leading the way when it comes to pet food and pet supplies in the Fort County area. Log on to learn how Pet Supply Port can help your pet live a happy and healthy life. PetSupplyPort.com.
Hi, my name is Brandon Kinster, professional baseball player. This is my wife Melissa and my dog Beau.
Did you know that every day police dogs risk their lives without the protection of a bulletproof vest? They do so to keep our communities safe, but they are not provided the vests that our police officers are.
As a dog lover, I believe that we should protect all of our canine officers with the same vest. So please join me and my teammates on Saturday, July 26th from 10 a.m. to 3 p.m. at the MECA Vest Canine Fest to help support awareness.
Hi, I'm Dr. Marlo Lichtenberger, owner of Milwaukee Emergency Center for Animals, and I hope all of you come out and join us.
When it comes to your pet's health, proper nutrition is vital to a long and healthy life. That's why American Natural Premium products are growing in popularity at your local pet food store. American Natural Premium uses whole ingredients including meat and balanced protein. Best of all, it's quality pet food at an affordable price. If your dog is itching and scratching, has runny eyes, or does the butt scoot boogie across your floor, it's a good chance your dog has food allergies. Log on to AmericanNaturalPremium.com to learn about premium pet food without the premium price tag.
So this bunny came in for not eating, not drinking, not producing any stools for about 36 to 48 hours. And mostly in these bunnies, they get gastric stasis, we call it. So in other words, their stomach shuts down, their whole GI tract stops, and then they stop producing stools, and they get a big dilated stomach, and they don't feel like eating. Either they're on a poor diet, they're not eating enough hay, or they have bad teeth, or they're stressed from some situation. So that's usually the cause of gastric stasis in bunnies. We see it very commonly. I would say probably about, out of all the rabbits that come in here for emergency care, probably about 80 to 90% of the rabbits have gastric stasis.
So bunny vessels are extremely small. and one little movement can bend our catheter because we have to use such a small one. Stay still, bundle. You're okay, buddy. Second attempt with a little bit more sedation on board. All right. Yes. Be prepared for jumping. Get up, Mom. Get in your face here. Okay, so second attempt went much better. Much better drugs than the bunny not flying at my face.
So what they're going to do now with this bunny is they've got an IV in. We had to give some sedation drugs just to calm them down. And now they're gonna start them on IV fluids and get them hydrated and make them feel better and then give some drugs so that we can start getting the stomach to move and the intestines to move. And then we'll start syringe feeding.
So for rabbits, guinea pigs, any of the small exotics that are herbivores, we do critical care. It's a powdered formula that's kind of their food kind of ground up, and it kind of creates a paste that's easy to digest for them. We want to get kind of a good amount of food in there so that we can get between the medications and everything, we get everything moving in their gut to try and get their motility back up. We'll wrap them in a blanket here, just so that they don't jump, because they can really easily injure their backs. So we kind of make them into a little bunny burrito, as we like to call them. And then you just go behind their front teeth here and into their mouth and just put a little bit of food in at a time, and they'll eat it and go from there.
In the rare instances when they won't take the food, we have to put in a nasal gastric tube in and then feed them that way. So the tube goes directly into the stomach and we'll feed them that way. But that's only about 5% of the cases we need to do that.
I have a rabbit here today because he has a chronically plugged tear duct. So the eye runs and he gets like a residue on his face that the technician needs to shave off. And he also has a malocclusion problem with the front teeth. They don't line up properly. Today's appointment is not an emergency, it's maintenance.
So the bunny has blocked ducts. They're the tear ducts. And because of that, it gets a lot of discharge coming from its eyes. So Sue brings it over here and we shave the bunny's eyes and clean it up. And then also his teeth are a little bit elongated, so she's gonna just clip his teeth. But he comes in here how often, Krista?
Once a week to once every 2 weeks.
So once a week to once every 2 weeks he gets this done.
And it looks really good. So
then maybe we've got it under a good maintenance
I think we're good. I think he's building up a little bit of scar tissue there too, because he doesn't get as much fur coming back.
Yeah, I appreciate what you did for him. That should
no problem.
Buy
Yeah,
some time.
like I said, I didn't take a lot off. I didn't get crazy. I didn't cut him all the way back. I just enough to give him some comfort. So that way, if you want to get it done later on this week, or if you want to get it done next week, he'll be okay.
We'll maybe eat some decon. This is Coco. Here's Coco's weight. And I will get you a chart. I have it.
Good job.
Possibly 8 decon.
Oh, good job. Give an injection.
Oh, little puppy. Hi.
He's on the phone with poison control right now. And it's regular decon, he said. Did she vomit it?
Get it out.
So we're right across the street from Stein's. It's not in New Berlin, it's in Greenfield. Okay? We'll see you in a bit. Bye.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.